1%.
The positivity rate now stands at 7.1% and has been on the rise. Even with the rise in cases, the state is working on plans to move out of the pandemic. KITV4 Shanila Kabir joins us live outside of the Department of Health tonight with the details. Shanila.
Yes, the DOH released a transition plan that includes priorities as the state now transitions from a public health emergency to disease management. For the past 2 years, Hawaii has consistently had one of the lowest per capita COVID-19 cases and death rates. DOH will use the experience from the past 2 years as it plans to move forward with 3 main goals in its transition plan.
We are transitioning the handling of COVID from kind of an emergency situation to the way other diseases are managed and treated. You contact your healthcare provider and you take it from there. You listen to their advice, and that's what we want people to do with COVID.
The goals are to treat the disease with vaccines and to move away from community testing sites to self-administered home tests. The next goal, detect and prepare for new variants, which includes surveillance and new approaches should one be detected. Lastly, enhance the community's resilience. The Department of Health will offer guidance to businesses and schools aimed at reducing transmission and the risk of spread in workplaces and classrooms.
We have a program up and running where we are taking samples of wastewater from all the different counties, sending those samples to the mainland, and then we have a lab there we're working with that is telling us how much COVID is in the wastewater and what variants might be present in the wastewater.
DOH is working on staffing at its lab so they can conduct wastewater surveillance for COVID. Local healthcare groups say they're on board with the methods in the transition plan. However, some believe it came out too soon.
The pandemic is not over. The way that the federal government and the CDC and some organizations have kind of bowed to the political pressure or the economic pressure has really not been something that the medical community is very happy with right now. DOH has no choice to do what they're doing, but we are still expecting we're going to have a surge in the BA2 that will continue based on today's numbers.
Dr. Miskovich also said there are many factors that could cause another surge, like this being an election year. Again, he and health officials agree with the transition to disease management, but this in no way is a mark that the pandemic is over. Reporting live, I'm Shanila Kabir, KITV4 Island News.